Welcome back to the channel. In our last conversation, we explored the phenomenon of the baby blues, that highly common transitional period of emotional turbulence that happens in the first 2 weeks after giving birth. But today, we are going to navigate a topic that requires a much deeper, more serious conversation. We are talking about postpartum depression, frequently referred to as PPD. It is absolutely vital to understand that postpartum depression is entirely different from the baby blues. While the baby blues are a temporary, expected hormonal crash that begins to resolve on its own within a couple of weeks, postpartum depression is a severe, long-lasting medical condition that can completely derail your ability to function and heavily interfere with your daily life. It does not simply fade away with a little bit of extra sleep or a warm cup of tea. It requires professional medical support. And talking about it openly is the very first step toward healing. To truly grasp what postpartum depression is, we have to strip away the idealized versions of motherhood that society constantly feeds us. You are told that having a baby is the most joyful, magical experience of your entire life. So, when a mother wakes up feeling a suffocating sense of dread, she immediately assumes that she is broken, but she is not broken. She is ill. Postpartum depression is an illness, a recognized clinical mood disorder that affects roughly 10 to 15% of mothers globally. And that number is likely much higher because the crushing weight of shame and guilt prevents millions of women from ever reporting their symptoms to a doctor. PPD can begin at any time during the first year of your baby's life. It might start immediately after birth, masquerading as the baby blues before intensifying into something much darker. Or it might sneak up on you quietly, months down the road, when you thought you had finally found your rhythm. The symptoms of postpartum depression are vast, and they often look very different from what you might expect. We have been conditioned to think that depression simply means crying all the time. But PPD is much more complex. One of the most common and least talked about symptoms is a profound sense of numbness. You might look at your beautiful, perfect baby and feel absolutely nothing. No surge of unconditional love, no instinctual bond, just a terrifying, hollow emptiness. This lack of connection leads to an immense amount of guilt. You might feel like you are just going through the robotic motions of changing diapers and feeding, completely disconnected from the human experience of mothering. Another incredibly common manifestation of PPD is postpartum rage. Instead of feeling sad, you might feel a fiery, uncontrollable anger over the smallest inconveniences. You might find yourself snapping at your partner, screaming into a pillow, or feeling a terrifying surge of aggression when the baby will not stop crying. This rage is not a reflection of your character. It is a blaring alarm bell from your overloaded nervous system telling you that you are suffering. Furthermore, postpartum depression is almost always accompanied by severe, crippling anxiety. You might find it utterly impossible to sleep even when your baby is sleeping perfectly soundly because your brain is caught in a relentless cycle of hypervigilance. You lay awake, staring at the ceiling, convinced that something catastrophic is about to happen. This anxiety often brings along something called intrusive thoughts. Intrusive thoughts are unwanted, scary, and often vivid images or urges that pop into your head uninvited. You might picture yourself dropping the baby down the stairs, or imagine the baby accidentally slipping under the water in the bathtub. Having these thoughts is incredibly common in PPD and postpartum anxiety, and it is crucial to know that having these thoughts does not mean you actually want to harm your child. In fact, the reason these thoughts cause you so much distress and panic is precisely because you love your child and want to protect them. But carrying the secret of these scary thoughts in silence is a heavy, isolating burden that feeds the depression even more. What causes a mother to plummet into this darkness? The etiology of postpartum depression is multifaceted, blending biology, psychology, and environment. Your body has just undergone the most dramatic hormonal fluctuation a human can endure. For some women, their brains are simply more sensitive to this massive drop in estrogen and progesterone, triggering a depressive episode. But biology is only one piece of the puzzle. Physical exhaustion and severe sleep deprivation literally alter your brain chemistry, making it impossible to regulate your emotions. Then there is the psychological trauma that can accompany childbirth. If your birth experience was frightening, if you felt unheard by medical staff, or if you or your baby faced life-threatening complications, that trauma heavily compounds your risk for developing PPD. Furthermore, women who lack a strong, supportive community, who are facing financial stress, or who have a previous history of depression or anxiety are at a significantly higher risk. Because postpartum depression significantly interferes with daily life, it fundamentally compromises a mother's ability to care for herself. You might completely lose your appetite, or you might find yourself unable to get out of bed to take a shower. Basic hygiene and nutrition fall by the wayside because simply existing feels like moving through thick mud. And when you cannot care for yourself, the monumental task of caring for a highly dependent newborn feels physically and mentally impossible. This is why professional medical support is not just recommended, it is an absolute necessity. You cannot out-exercise, out-meditate, or stubbornly push your way out of clinical depression. You need intervention. If you are listening to this and recognizing these symptoms in yourself, I need you to hear this loud and clear. Reaching out for help is the bravest, most maternal thing you can possibly do. It is proof that you are a good mother fighting for your well-being. The treatment for postpartum depression is highly effective and usually involves a combination of talk therapy and medication. Cognitive behavioral therapy, or CBT, is a phenomenal tool that helps you identify and dismantle the negative, spiraling thought patterns that depression creates in your mind. It gives you practical strategies to manage anxiety and process the massive life transition of motherhood. Alongside therapy, medication can be a literal lifesaver. Antidepressants, specifically selective serotonin reuptake inhibitors, or SSRIs, are commonly prescribed to help rebalance the neurotransmitters in your brain. And please, do not let the fear of medication stop you from getting help. There are many safe, highly studied antidepressant options that are completely compatible with breastfeeding. You do not have to choose between feeding your baby and saving your own life. You can and should have both. Now, I want to speak directly to the partners, the family members, and the friends of new mothers. Postpartum depression is a thief. It steals the joy of early motherhood, and it often does so in secret, because the mother is too ashamed to admit she is struggling. It is your absolute responsibility to pay attention. Do not just ask her how the baby is doing, look her in the eyes and ask her how she is actually doing.